We start this evening with a 10 Investigates exclusive. A Tampa mental health care facility is under investigation after someone died in their care.
Records show a man stopped breathing after 6 staff members restrained him, holding him face down. The state has now issued an emergency moratorium, blocking the facility from admitting any new patients. And tonight, our team is learning this is not the only time the facility has been investigated for how someone was restrained.
10 Investigates Jennifer Thomas is live outside that facility tonight, where, Jen, there are still patients inside.
Yeah, there are. The state's order does not shut down the IBIS's Adults Crisis Stabilization Unit. It just does not let them admit or readmit anyone new. Now, documents also reveal that there is video of the restraint, a controversial technique that many law enforcement agencies have actually stopped using. This 30-bed mental health facility in Tampa is now the center of a state investigation. Records show a man was admitted back on March 8th. 11 days later, on March 19th, the man who was diagnosed with schizophrenia became agitated while waiting to see his parents. Documents say he was screaming for his mother and threw a plastic hamper. That's when 6 behavioral health technicians moved him into a seclusion room and held him face down as he said, "I can't breathe, I can't breathe."
How long was this individual being held in this prone position while restrained?
Seth Staunton is a professor at the University of South Carolina School of Law. He's an expert on prone restraint.
The prone position.
And testified in the Derek Chauvin trial. Staunton says this same type of restraint used on George Floyd in Minneapolis can be deadly.
I need to know where exactly that individual was on the upper back and how much weight they were putting down on the person. The other question that I have is about the physical condition of the individual himself.
Documents show an IBIS healthcare tech heard raspy breathing from the man being held down, but never reported it to a nurse. The nurse later injected the man with medication. After that, he went limp. One tech asked, "What if he is dead?" Another replied, "I don't give an expletive." Although techs would check on the man who was still in the prone position with no response, it would be 17 minutes before staff started CPR.
So the idea of putting someone in this prone position and holding them there and then medicating them and then leaving them there, I just can't begin to justify that series of events.
Less than an hour after the restraint began, he was pronounced dead.
I cannot begin to justify why anyone would leave someone apparently unconscious face down and unmonitored for any prolonged period of time. That's inexplicable.
State investigators found the facility's policies do not allow a 6-person takedown restraint, nor did the facility complete an investigation into the client's death. When investigators arrived 3 weeks later, all staff members involved in the incident were still working in the unit. They also failed to report the death to the Department of Children and Families. And back out here live, we did reach out to IBIS Healthcare today about the allegations and the moratorium. They would not speak to us on camera, but they did send us this statement that says, in part, we are cooperating fully with all appropriate parties throughout this process. Now, we have also learned that this facility has been investigated before when it comes to a restraint. Back in 2020, they were also cited for how they restrained a person. For now, we are live in Tampa. Jennifer Titus, 10 Investigates.